You're listening to the official OSAP Podcast with Michelle Lee, bringing you infection control tips and information to make you a safer practicing clinician. And now, here's your host, Michelle Lee.
Hello and welcome back. I'm Michelle Lee, your host today for OSAP's official podcast. And I am thrilled today to have as my guest, Amanda Hill. Amanda is a dental hygienist. She's an OSAP member. She is a fellow podcaster. I think that's how we really kind of started getting to know each other. And she is she's married. She's a Navy spouse and a mom of 3. Welcome, Amanda.
Well, thank you so much for having me today. I am so excited. I must say, long before I had a podcast, you had a podcast, and I love the OSAP podcast.
Oh, well, thank you very much. I know I'm thinking back. I remember the first time I met you, Amanda. It was at the Greater New York meeting.
It was, yes. And I was so excited to meet you. I was really fanning on you when I met you because I was like, oh my gosh, it's Michelle Lee from OSAP.
I love that. Yeah, no, I am nothing to be. I just like to talk and tell what all the great people at OSAP do. That's what I do.
I'd love to do the same type of thing. Yes.
Yes. Well, you know, Amanda and I had a great conversation a few days ago, and it made me think I need to have her on the podcast because what we were discussing, it just resonated with me about how many people are feeling the same thing. And here we have Amanda, who is a infection control nerd. Right?
Nerd.
Can I
say
we'll
that? Go with nerd.
Yes.
I'm totally a nerd. Yeah.
And she's out there consulting, teaching, yet she's still practicing dental hygiene. And so as a practicing dental hygienist, she is trying to figure out all of this interim guidance and how to make it happen. And you said, and I hope I phrased this right, Amanda, you said to me, you know, no matter how much we know what we're supposed to do, it's still hard.
I think I said, I think it's impossible to do it all.
Yes.
I mean, I went that far to say, I truly don't know how to do all of the things the way that it's set up right now, the way that our dental structure is set up, how to check all of the boxes that, you know, that are on that list, that are in that interim guidance. And it's just so hard. It is. It's such a challenge.
And we do know that. And, you know, to the point that OSAP had a team back in June that worked for weeks, taking the guidance from CDC, ADHA, ADA, OSHA, in creating that best practices checklist. And I remember being on those calls and the discussions to, you know, how do we do this? What's the best way to implement this? And trying to provide tools. And even with all of that, yeah, it's tough.
It's so hard. Yeah, it really is so hard. I think, you know, truthfully, I think the only places that I've ever been, even in all my career, I've been a hygienist now for almost 25 years. I've been in dentistry since I was 15. So I mean, a long time. The only time I've ever seen people do all the things, even pre-COVID, you know, is if I was in an FQHC or when I worked for the Navy. And in those roles, you actually had somebody whose job it was to do the infection control. And that wasn't like it was their extra job on top of the 50 million other jobs that they already had, which is your standard private practice. And so it's really hard to do all of it right. And make sure that everybody understands the why. And I think that's really the important thing is everybody understands why do we have to do these things? Because if you don't understand why, you're like, we can skip that.
Right. Well, and I've seen some things, some interviews you've done on social media out there, and you do a really great job of explaining the why. And I think that's a great way to start. It's especially with other team members who may be wanting to push back on this, especially now. We're seeing a lot of that pandemic fatigue, aren't we?
Oh my gosh, we're exhausted.
We're tired.
Yes. So tired.
Yes. I mean,
Yes.
I know even I have family members that are just tired of donning the mask to go to the grocery store, right? Much less all that has to be done in a dental office to keep yourself safe, your team members safe, and your patients safe.
It's a lot. It's a lot to put on. And if you don't have a team that is all on board and that is all willing to pick up for each other, I mean, everybody has to be willing to help each other. It's just, it can't work because I can't run down 5 flights of stairs, knock on somebody's car, take their temperature, run back up, 5 flights of stairs, turn a room over. You have to have the whole team on board, understanding how to put all these new practices in place. And heck, put all the practices before that we've been supposed to be doing that I bet they weren't doing.
Yeah.
Yeah.
Right. Well, so I want to throw this kind of back, or I don't know if that's the right term, but tie this into your podcast. So Amanda has a great podcast that's part of the, she started like we did with OSAP, the Dental Podcast Network. And I believe your podcast is about to go off on its own.
It
Still
is
under that umbrella, but it'll
Right.
have its own page, right?
It will have its own feed in which I dream one day you can stand in front of Alexa and say, Alexa, play your dental top 5, and she will do it.
And that is the name of her podcast, the Dental Top 5. So tell us, so today, I want to know what your dental top 5 are in reference to if you can only do 5 things, what are the top 5 things to make this interim guidance work in your practice and the day-to-day?
All right. So it's very hard to say 5 things because really there are 5 million things.
Yes.
Maybe 5,000 things. And how do you cut out a thing,
Yes,
But I think the number one thing that you have to know is you have to know your instructions for use on whatever products you have chosen for infection control. Be that your mask, which side goes out? I see people wearing their masks upside down or flipping the loops of their mask. Don't flip the loops of your mask. It gaps the side. Or, they don't know how long the contact time is for the infection control wipes they've chosen. Or they don't know whether the paper goes up or down in the autoclave, right?
Oh my gosh. I think that is the most asked question or debated topic on social media today. And I just want to scream every time, read your IFUs.
That's it. So no matter what, you have to know how the product works. And the why of that is because when that product was approved in a certain way. And so that product was approved by using those specific instructions that are on the packaging. And if you don't use those specific instructions, it's not going to do what you think it's supposed to do. So read your instructions for use.
Right. Oh, excellent.
So that's your first one. You got to do that. And you have to do that when you get a new product in, because it's not going to be the same every time. So,
right, yeah,
it changes.
I'm right about this. Correct. Every brand can be different.
Every brand is so different. It was tested a different way. It was approved a different way. So you have to look at the back of that. It's the same as think about like fluoride varnish. They all work differently. All these products work differently. And so don't assume that one product is going to work like the other product because patients aren't going to get the benefit or you're not going to get the infection control benefit that you need. So that's number 1. So number 2 is you have to wear proper PPE. Do not skimp on your PPE, my friends. Your PPE is your last line of infection. We like to pretend like it's our first. We like to pretend like it's like the Star Wars force field. It will protect me from all, right? Nothing can get past. Really, this is your last line of defense. But take it seriously. Know how to wear the proper PPE, how to put it on, how to don it, how to doff it, and know what you're supposed to be wearing. So do you need an N95 mask? Do you need a level 3 mask? What's up with the level 1 masks anymore, right? We're going to stop buying those now, right? COVID has taught us the level 1 mask is not our friend, I hope. Because I tell you, I still temp in offices where I'll walk in and there's a level 1 mask, and that's all they're giving me. And I'm like, yeah, no, I have my fitted N95 and my level 3s. Thanks. So,
you know what? I want to jump in here and interrupt you for a minute. I saw something that you shared on on social media recently, and Amanda does a lot of temping out there, and that was kind of part of my old life with the temporary staffing company that I did for years. And I would have loved to have had you as one of my temporaries. My gosh, you are the dream. But she has a, a bag with
My temping toolkit.
Your toolkit. That's it. And you have all of this stuff in the tool in the bag, so that when you go into an office, you don't have to rely on them giving you the right PPE, correct?
And I don't have time to read their IFUs. I can't walk into an office, read all of the IFUs of all of these stuff. I'd have to come the day before. And so if I come with my own things that I know the IFUs, I know how they work, I'm comfortable with how they work, that I can get through my day and keep myself safe and keep my patients safe. And that's really what it's all about, is making sure that we're all as safe as we can be and provide that essential care that we are providing.
I love it. I love it. Okay. What's next?
Okay. So number 3 is your monitoring. So don't skip this step. You have to monitor your autoclave. Remember the spore test that we do? Remember we look to see whether the bag changed the colors or the tape changed the colors, because you want to make sure your autoclave's working. You have to monitor your water lines. Water lines are kind of my jam. If you've ever heard me talk, you've heard me talk about water lines, but you have to test your water lines. You need to monitor your equipment. That goes a little bit back to IFUs, understanding your IFUs for, say, your suction. We need suction that sucks. If suction doesn't suck, it sucks. So, and that's controlling some of our aerosols, so that's really important to maintain that, run your suction cleaner, make sure you're doing those things. And the bigger part is make sure you're writing down that you did those things, because if you didn't write it down, it didn't happen. And if for some reason, God forbid, OSHA, dental board, whatever, knocks on your door and they want to do an inspection, they want to see record keeping. How much you can swear on your grandmother's grave that you did this, it didn't happen. So you have to write it down. So make sure you're doing your monitoring.
Mm-hmm.
All right. So number 4 is understanding the hierarchy of controls. And I talked about it a tiny bit in proper PPE, but OSAP, you guys put out some great stuff about hierarchy of controls, right? Yes. I loved it. And the big one for me in the hierarchy of controls is, can we please stop seeing sick patients?
Oh, yes. Yes.
If I hear the front desk say, it's okay, she wears a mask, I'm just going to pack up now and drive away. I'm going to be like, I'm done. I'm finished for the day.
Yes.
So I think if COVID taught us anything, if we've learned anything, and in our hierarchy of controls, let's stop bringing in sick people.
Well, yeah. And that's something that people, it's been part of the guidance forever, right? Yes, if someone is sick, you reschedule them. Right.
But I think we've been afraid to do that for too long. And I think that I hope that COVID has taught us that these aerosols that we don't see are there, and it's not good for us. It's not good for your employees. It's not good for other patients that come in the door. And so when you're asking a patient to reschedule and maybe they're upset about it, like, oh, it's fine. It's just a cold. It's fine. You could say something like, we have to think about our other patients. So, put it on that, and then they'll think, oh, well, I certainly wouldn't want to walk in after somebody that was sick. And so think about it that way, or put it on them and say, your immune system is down. And so you coming into our office, we wouldn't want to introduce anything to you that could make you sicker. Mm-hmm. So I think that's really important for us to remember those hierarchy of controls, not think that our PPE, even though I want you to wear proper PPE, but not think that the PPE is the force field that keeps you safe.
It's at the very bottom.
It is the very bottom. It is the little tippy of the pyramid, but at the bottom, because it's an upside down pyramid.
The inverted.
Yes, exactly.
Pyramid.
Yes. It is not the thing that's keeping you safe. Things that are keeping you safe are not letting in sick people, making sure your equipment works. All those kind of things are really the things that are going to help you keep you safe and keep your patients safe.
Yes.
So, and then number 5 is having SOPs. So standard operating procedures. And so no matter what your office decides, no matter how your office decides to do, your infection control process, everybody needs to understand what is happening. So what order do we, break down a room, and how do we, are we using a spray, and then are we using a wipe, are we using a wipe, what is the system? Just like in our central sterile, what is the system? How does it go from clean to how does it go from dirty? Because we are, I'm so busy now. I can't, 60 minutes is no longer enough for me. I probably just talk too darn much, but between, having to like, feel like I have to talk clearer through the N95 mask and the face shield and all that stuff. And so I need every minute that I have. And so sometimes I really need some help turning a room over. So if somebody can run in and start, I already know where they are in the process, and we're not going to miss, I don't know, pulling off, some barrier that, I thought that was clean. No, that was really dirty, or something like that. And so when you have that SOP around your infection control procedures, and you have that SOP on, hey, on this date, this is when we test water. On this day of the week, this is when we test the autoclave. And then Susie is sick and we know it's Thursday, and we know Thursdays test the autoclave day. It doesn't get missed for another week. And what if the autoclave had really failed on Wednesday?
Yes. And the SOP should be something that everyone knows and reads, and not something just stuck up on a shelf.
Oh, wait, that book that nobody actually knows about that we just talk about? Yeah, exactly. I want them
just in case OSHA comes in to inspect. Yeah.
Right. I like to have them posted, have them posted on cabinets, have them laminated, have it around. And that way, when your friendly temp comes in, hello, hi, I see, Mondays, Mondays we run our enzymatic cleaners. Oh, I'm here on a Monday. Oh, okay. I'll run enzymatic cleaner. Cause I know that happens on a Monday. Or on Tuesdays, we change the suction traps. Oh, I'm here on a Tuesday. Okay. Where's your suction traps? I'll change mine. So that way, it's consistent and everybody understands, it's clear, it's listed. Let's have something right over your autoclave that says paper up or paper down. Exactly. And then nobody has to write on Facebook and ask their millions of Facebook friends the right answer that they don't know the right answer.
Right. Oh my gosh. Those all make such good sense.
And there's still a million that we didn't even talk about, because there's a million. Yeah. I would say that.
Do you think that's a good top 5?
Yeah.
Yes. Well, and one more question. So, what are you doing? How are you talking to your patients about what you're doing to keep them safe now? Because before all of this happened, most patients didn't know what PPE stood for, right?
I know, right?
I mean, that's a household word acronym
now everybody
now.
knows that. Yeah.
So I imagine that more patients are asking, and they're watching, they're looking.
They are watching. And I'm really making a point to sort of talk out loud what I'm doing while I'm doing it. And I gotta tell you, if there was ever a time that you wanted to introduce something into your practice, that you were like, I don't know how patients will receive it, now's the time, because they're like, yeah, whatever. So I just started using intraoral suction. I'm using an Isovac on all the patients, and everybody's like, oh, patients don't like it. It's really bulky in their mouth. And you know what? I'm using an Isovac on everybody, and I'm saying, no, this really helps us control the aerosols. And patients are like, oh, okay, all right. If it includes, yeah, I'm good. I'll figure it out. I'll deal with it. And in the end, it's fine. They like it. So now's the time where you can introduce some of those things and talk to patients about those things that you have done. It's a great marketing tool to let patients know how you are keeping them safe, because they want to know. I mean, they're a little, particularly right in the very beginning, they were really nervous to come back to the dentist office, and they'd heard all these things that could happen. And so now if you tell them, along the way, what you're doing, we're checking their temperature, and I'm putting on all this stuff, and I'm wearing this silly face shield now. And, we kind of talk about all my PPE, and they like it.
Don't you think that is going to help with new patient referral?
Absolutely.
I mean, you use that time and talk to your patient about what you're doing. Those patients are going to go, I don't know what your dentist is doing, but let me tell you how my dental practice is addressing this COVID thing. It is wonderful.
I have quite a few friends and family members that are sending me pictures from their dental office, and they're like, are they doing it right?
Wow.
So everybody listening, they're watching, and they might be asking their fellow, their friends that they know that are in dentistry, like, did they do all the things right? Are they doing all the things right? I just posted a picture of myself on Facebook yesterday with the ISAVAC. I was getting some guided biofilm therapy. And then I had the glasses on, and my Aunt Cheryl was like, "Why are you always wearing glasses? Why do your patients always wear glasses?" And I was like, "Well, let's talk to your dentist, my friend."
Yeah, I saw that photograph. I loved it. I just had my first experience with that in my mouth as the patient.
Yeah.
And, and it wasn't that, I mean, it was uncomfortable, but it wasn't terrible. And I loved it that there was that option there. I thought that was wonderful. Yeah.
Yeah. It's a great tool, and it's a great thing for controlling aerosols, which is, the thing that we have, all of a sudden decided, that we're going to start paying attention to, even though I think John Molinari was talking about it back in 2004.
Probably. Yes. Well, oh my gosh. I mean, thank you so much. You know what? I think you and I, when we get together, we're never at a loss for words. So this is great.
Never. Never. No, thank you for having me on. I got to tell you, like I said, I've been a big fan of the OSAP podcast from the beginning. I just think you are a gifted podcast host.
Oh, I just like to talk. I think that's all it is.
I do. Yeah.
And I learned so much. Every one of these I'm learning. So
Me
I
too.
love it. And there's
I love
just
it
so
too.
many amazing experts out there that we can all learn from. And I just want more and more people to have access to it. So thank you. Thank you for joining us.
Absolutely.
And thank you all for being part of this and tuning in. And I just want to, if you're not a member of OSAP, we invite you to become a member of OSAP. Believe me, it is very affordable. It's easy. Go to osap.org, click on the membership tab, give you all the information. And also our next major event coming up is the OSAP Boot Camp. It is this year virtual, of course, January 25th through the 28th. It will be, it's a foundational infection control training course, but very intense. And of all years, if you've never attended, this is your year to be there. Because we'll address all the interim guidance. We have speakers from all over, including CDC. They are always such a great support of this training. And if you can't log in when we're doing it live, if you register, you will have access to complete the course for 60 days. So you can do it at your leisure. It is, again, a great opportunity, and it's at a reduced price this year because it is virtual. So we don't have all the added expenses that we normally have with the hotel and the coffee and all of those things that you have to offer at these events. So now is the time to consider that. But until next time, thank you for all you're doing to make every dental visit a safe visit, and wishing all of you a great day. Thanks.